Hello friends, I am Dr. Chetan Mahajan. I am working at Malakpet Care Hospital as a general and GI surgeon. Our areas of interest are hepatobiliary surgery, pancreatic surgery, colorectal operations, laparoscopy. Today I am going to talk about a very common problem in our society, what we loosely call as piles or fissures. So basically piles, fissure and fistulas are three different diseases happening in the same area. A lot of people in our society silently keep suffering from these problems because they are simply shy, number one, or they have got misunderstandings about the treatment part. A lot of patients feel that if they are treated surgically, he or she will not have control on the motion and they'll face social embarrassment. My request to all of you is please don't get into these things. When you talk to an expert, a good doctor, all these misunderstandings will be cleared. Today I am only talking about the piles and fissure part, fistula sometime later. So basically bleeding per rectum while you are passing motion is one common symptom. The second important symptom is pain while passing motion and burning sensation and or bleeding after the motion or during the motion. Now this symptom complex basically will indicate the patient is having either piles, which is called as hemorrhoids, and or fissure. Usually painless bleeding is associated with piles and pain and bleeding are associated with fissure. The simplest way to get it diagnosed is visit a good doctor or surgeon who can diagnose it for you. To confirm the diagnosis, he or she can always ask for what we call as a sigmoidoscopy. Once the diagnosis is clinched, usually low-grade piles, say what we medically call as grade 1 or some grade 2 piles, can be managed with medical treatment but with lot of restrictions. The common restrictions told to the patient are avoid constipation, take your tablets on time, have a rich fiber diet, and avoid heavy or masala or a typical spicy kind of food, which is very difficult to maintain in long term. Patients who have tried all these things, despite of this are having trouble of bleeding and pain, we usually recommend surgery. Now surgeries as popularly can be done in a conventional way or laser. Laser hemorrhoidectomies or fissure problems are usually for select category patients. Large hemorrhoids or piles or large or chronic fissures sometimes may not respond well to laser treatment in long term. The conclusion is that leave the modality of the surgery and treatment to your experienced doctor and go ahead with full faith. The notions of losing control of motion and long-term problems do not exist. So my request to you is that don't go by that. If at all you or your friends or anyone of you are suffering from these kind of issues, please come forward, contact our helpline number, and we are there to serve you. Thank you very much.